Air bubble signs in small incision lenticle extraction. In short form, SMILE. There is no financial interest in this video. Dissection anterior to the lenticle should be done always first. Otherwise, lenticle will get attached to the top cap and the removal will become difficult. As you see, when the femtolaser air bubbles are coming out, atmospheric air bubble is going inside and surrounding the instruments. This is how the dissection anterior to the lenticle is done. Then you do dissection posterior to the lenticle, in which you depress the instrument, go in. Here also you see, as the femtolaser air bubbles are going out, atmospheric air bubbles are going in and surrounding the instruments. Then you take out the lenticle, inspect the lenticle to see whether it is fully removed or not. Air bubble sign 1. This is a thin lenticle. Entry is into the wrong plane. Instead of anterior, entering into the posterior to the lenticle. Now you can see here the initial dissection anterior to the lenticle and initial dissection posterior to the lenticle. A surgeon is thinking that he is going anterior to the lenticle, but actually he is entering and dissecting posterior to the lenticle. So dissection is going on now, and surgeon is thinking he is anterior to the lenticle. So whenever he is trying to go into the same area again, atmospheric air bubble will surround the instruments. But surgeon is unaware that he has already dissected posterior to the lenticle. So any instrument you put blunt, sharp or a forceps, it will get surrounded by the air bubble. This is air bubble sign 1. Now you need to retrieve this lenticle from the eye and do a dissection and remove the attached lenticle to the cap. We use a simple technique which is blunt on sharp technique. You use the sharp instruments, separate the lenticle, and above that introduce blunt instrument and start the dissection. The dissection goes on similarly and lenticle is taken out. Air bubble sign 2. Because of repeated entry of instruments in the eye, the cavity is filled with the atmospheric air. Air bubbles may not be seen now. There may not be any resistance to the instruments when you introduce inside the eye. As you can see here, because of previous repeated entry, the cavity is filled with the air and you may not see the air bubble surrounding the instruments. Surgeon is still trying to find out the plane, but he has non-resistance entry into the plane posterior to the lenticle. This is air bubble sign 2. After knowing air bubble signs 1 and 2, if similar thing happens in next case, management is relatively easier. This is opaque air bubbles where dissection may be difficult. Again, surgeon is thinking that he is anterior to the lenticle, but actually is posterior to the lenticle, and you can see air bubble sign 1, where air bubbles are surrounding the instruments. But he need not wait for the sign of air bubble 2, and he can retrieve the lenticle the way it was shown before with blunt on a sharp technique. Air bubble sign 3. Delayed dissection. No femtolaser air bubbles are seen. As you can see here, hardly any air bubbles are seen, even under low magnification. In these cases, identification of planes may be challenging. Surgeon is trying to find out the planes for a dissection, and it is little bit difficult to find out where the entry is there or incision is there and how to enter. It may happen that even if he finds the plane, as you can see here, he may not know whether he is anterior or posterior to the lenticle. In these cases, air bubble sign will help him to dissect the lenticle properly and do the dissection anterior and posterior to the lenticule and successfully and fully remove the lenticule out of the eye. Since the femtoral air bubbles are not here, the dissection may be little bit resistant and may be little bit difficult and time consuming, but patients will make it easy to remove the lenticule from the eye. As you can see, the lenticule is removed now, and once it is removed, it is inspected whether it is fully removed or not. In conclusion, air bubble sign 1, femtoral laser versus atmospheric air bubble. Sign 2, no atmospheric air bubble. Sign 3, delayed dissection, absorbed femtoral laser air bubbles. Thank you.